The Honourable Member for Wolseley.
Thank you, Madam Speaker. This government's fatally flawed approach to revamping emergency services in Winnipeg is reaching a new low in terms of this government not listening to the obvious facts being presented in front of it. Just yesterday, we had the doctors from the urgent care centre at Misericordia go publicly on the record and say, quote, "In our opinion, there is certainly no patient care justification for this closure." This minister's been claiming all along his moves are to improve patient care. How does he respond to the frontline workers telling him he's wrong?
Well, Madam Speaker, I would respond by pointing the member and others to the Peachy report, which was commissioned by the NDP government. In fact, Dr. Peachy was sought out by the NDP as a sole source contractor. They looked for one person who could redesign the system. They looked for one person in all of North America that the NDP would trust to redesign the system, and they picked him. And now they're trying to run away from the evidence, run away for political expediency. They had no plan before. They didn't want to act on evidence. They were happy to leave people in the ERs for hours and hours. We're not satisfied with that. The member for wait times can sit there and be satisfied, but we are not satisfied with that, Madam Speaker.
I thank you for that, Madam Speaker. And the only slight problem with the minister's reference to the Peachy report, the Peachy report does not in any page suggest that the Misericordia Urgent Care Centre should be closed. It's not in there. The minister gave a flippant answer when we raised this point weeks ago, saying page 62. Page 62 does not even contain the word Misericordia. This agenda has never been about patient care. It's been about cutting costs. So let's see if the minister will listen to his own words. Who said, quote, "It doesn't cost as much to operate an urgent care center as it does an emergency room"? It was this health minister in estimates, Madam Speaker.
Well, and I think the proof is there, Madam Speaker. It doesn't cost as much, but we're doubling the number of urgent care centres in the city of Winnipeg, Madam Speaker. We're ensuring that there is the proper care. As Dr. Peachy put in his NDP Commission report, there should be 2 urgent care centres in Winnipeg. There should be 3 acute care hospitals in Winnipeg, and there should be a subacute tertiary care unit. That's exactly the model that we're following, the model that was put up by the NDP, the sole source contract that was led by the NDP. We're following the plan that they didn't have the courage to follow. Their solution to everything was to pour hundreds of millions of dollars more into ERs with no results. We'll get results where they failed, Madam Speaker.
The minister has just conceded that his agenda all along has been about cutting costs and not patient care. I do thank him for that clarification. There is an additional problem with the answer he just gave. He says there's going to be additional urgent care centers. Well, it turns out his own official has said, this is Mr. Brock Wright, quoted in today's paper. Wright said, quote, "In the future, he expects most vulnerable Misericordia patients will choose Health Sciences Centre, with some going to St. Boniface Hospital, not the suburbs where he proposes to build more urgent care centres." He won't listen to doctors. He won't listen to nurses. Will he at least listen to patients? I table this document, Madam Speaker, dozens of personal stories with the names removed to protect confidentiality of what Misericordia Urgent Care means to this community. Will the minister commit today to back off and keep urgent care open at the Misericordia?